Hey everyone, welcome back to episode 13 of our Anatomy Focused Laser series. As you guys know, we are starting to look at the spine. And last week we looked at those different segments and the important role that each of them plays. We're now going to break down that anatomy, particularly that kind of structure of our segments and also our muscles that innervate those areas. So this is going to be a big one, so bear with me on this. Pop up a picture here of that vertebrae anatomy. As you can see, right at the top there, or right at the top here, we have our spinous processes, the transverse processes, and then obviously you can see it better in this picture here. We have the meninges in the middle, that grey matter, that white matter, the dorsal root, ventral root, the spinal nerves that obviously come out of the sides there and innervate all sorts of different things. We've got the nucleus populus, the big blue bit at the bottom, the vertebral body, the disc annulus as well, really important stuff there, the foramen transversum, anterior tubercle of transverse processes, they like to give me big words, and then the posterior, exactly the same thing, the superior articular processes, inferior articular processes, and foramen there. I think they're quite complex structures, particularly obviously in this middle section here, when we're looking at cases like IVDD and all that jazz, and kind of impacting this middle section versus conditions that are more bony in their structure, so arthritis, lumbosacral disease, kind of impacting the rest of the bone there. So that is a very quick summary of that vertebrae anatomy, because I actually find the muscles a little bit more interesting. So now we're going to look at the epaxial muscles, these really long ones, and we have three here. So we have the longissimus dorsi, which is that really long one. We have the iliocostalis, and we have the, I can't say this one, multifidus. And what their roles are is spinal extension and stabilization, that fine postural control, so we can do those little movements, and segmental stability, protection of intervertebral joints. So again, it's all that, just giving the spine the stability that it needs to give it that protection and that control with the different movements that they're going to be asked to do. Clinical relevance, commonly affected in spinal pain, again IVDD, post-surgical weakness, multifidus atrophy linked to chronic spinal dysfunction there as well. So whole range of different jobs that those guys do. We then have the hypaxials, so these include the longus colli or longus capitis in the cervical, in that kind of first cervical region. Again, pop up a picture. We have the psoas major and minor, and then the quadratus lumborum. Again, I can never say these words. So we have different range of muscles here, and their function is that spinal flexion, that lateral bending, so bringing the body from side to side, that core stability, and keeping again everything nice and tight where it needs to be, load transfer, postural support during that locomotion, so again more postural, more stabilizing, and just giving that spine the structure that it needs. With these guys, the clinical reference, they're often actually quite weak or inhibited with lumbar pain. So if we've got patients suffering there. The psoas involvement is really common in lumbosacral disease. I think we would all agree it's one of the most common issues that we see, particularly in our sporting patients. So again, so much going on there. Then we're going to get a little bit deeper in the structure. So we have the spinal muscles that are stabilizing. So we have the multifidus, the intertransversari, and the rotaris. my pronunciation may not be perfect, guys. The function here, you know, control that micro movement between vertebrae. So this is much more on a micro level. It's giving that proprioceptive feedback to the central nervous system. It's preventing excessive shear forces as well. So any abrupt movements, it's helping to mitigate that. And clinical relevance here, you know, early dysfunction in chronic back pain. So it's one of the things that very early on starts to become, you know, we start to see it no longer functioning as well as it should, as a really important target for our spinal stability within our rehab. So we shouldn't be forgetting those really tiny muscles when we're looking to, you know, improve that stability and that spinal performance. Now we're moving on to the superficial supporting. So those were the more deeper structures. These are those superficial muscles that we probably talk about a lot more regularly. So this is your trapezius, your lats, and your rhomboideus. And these guys, like I say, we do talk about these because they're so much more superficial, much easier to visualize, palpate, etc. And they link the forelimbs to the trunk. You know, they link that forelimb, spine, trunk kind of posture, and it assists, they assist in that gross movement and posture. So again, a lot of posture work, a lot of stability work, a lot of just holding everything together. And issues here, often compensatory. You know, we get those shifts, that movement, that change, particularly with spinal pathology. I think we talk a lot about, you know, if we've got hip dysplasia and the compensatory issues we get because of that. Well, what about when it's spine and we've got compensatory as a result of that one? And we often see tension patterns contribute to that secondary pain there. So lots going on. As this is such a long one, I think we will separate this one into our next video, because this is such an important one. I don't want to rush through them. So join me next week and we will start looking at the different nerves, because I know this is a complex one. So we will keep it easy and straightforward, and join me next week in the next episode.